Joining us now, registered nurse and the president of the New York State Nurses Association, Nancy Hagans. Nancy, I'm so looking forward to this conversation because you do have real concerns about how AI is being rolled out in this setting. You testified before the New York City Council. Patient safety, quality of care, they're top of mind here. Why do you believe those two items in particular are being negatively impacted in this rollout?
Good morning, and thank you for having me here today. As I call it, artificial intelligence is artificial caring. Okay? Every patient deserves a nurse at the bedside. When the hospitals will tell you, right now we have 20,000 nurses fighting for a fair contract, and our core demand is about a real nurse at the bedside. No one could replace a nurse. While artificial intelligence could help enhance patient care, however, artificial intelligence could not replace a nurse. We are human beings that are built differently. I will give you an example. A place like Mount Sinai just rolled out virtual nursing and ambient nursing. They're spending over $100 million without any nurses' input, and they are not publicly disclosed how they came up with these ideas, and nurses have no input in the technology. In the past, if we were going to roll something out, we would have nurse test it and make sure it's piloted to make sure that patients are being cared properly. When you connect a patient to a machine and the machine start beeping, the patient might have removed something and then the machine is not able to pick it up. A real nurse will go in there and pick up what's going on. Hospitals are cutting corners with artificial intelligence in order to replace nurses. And my goal is to say to everyone, every patient deserves a human being at the bedside. Every patient deserves someone to take care of them. A machine is not able to tell you, are you in pain? When I walk into a patient's room, I said, are you in pain? The patients may say no. But when I see the grimaces in the patient's face, I know that patient is in pain. When you connect a patient to a machine to read their blood pressure, I walked around with a blood pressure of 90/50. The book will tell you a regular blood pressure is 120/80. Does that mean I need to be treated? No, that is my normal blood pressure. The machine does not have your history. Okay, right now, Mount Sinai Hospital in the cardiac cap has an assistant called Sophia to assist in the lab. The nurses have to stop and check to make sure Sophia is not making mistake. How
Right.
realistic is that? So you need that nurse to check the patient.
Right, and in many of these cases, I'm assuming you would be of the mind that these are life and death decisions that are being made too. So let's get the flip side of the argument. We have about a minute left. Some argue AI can help with staffing shortages, burnout, administrative burdens. Is there a place for AI use in this field? And if so, how would you recommend its implementation?
First of all, AI cannot replace nursing shortage. There is not a nursing shortage. Nurses are walking away from the bedside because of the working condition right now with the AI. We are both human beings. The two of us are different. How could an AI replace someone in order to care for a human being? We welcome artificial intelligence in order to enhance better care, in order to equip with better machine. That is going to be operated and tested by nurses before we start testing it on the patients. So AI could never replace a human being. AI could never replace a patient. When it comes to patient care, we are not willing to back down because human beings are not for sale.
Yeah.
The hospitals are doing the AI in order to cut corners. And as a nurse, I am here to protect my patients every day and every hour.
Well, it is important awareness for not only nurses, but also for patients. So I certainly appreciate you being here and voicing your concerns. Nancy Hagans, thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.